Can't believe to say this, but I'm starting my 20th year at Inspira.
I'm celebrating 10 great years here at Inspira.
15 years just seemed like it flew by.
30 years later, here I am.
Sometimes it feels like more, and sometimes I feel like it was yesterday. You know, it just depends.
I look at my journey and I'm like, oh, this many years? That's a lot of years. Actually, I feel old. There's gonna be editing to all that, right?
I don't feel like I'm 20 years older.
For me to be in one place 20 years is amazing, and I hope to do 20 more.
Makes you feel like a movie star. I'm Kathy, and I'm excited to be celebrating 50 years at Inspira. I had just turned 19, and I started in the office, and when I looked around, I thought everybody was really old. And I remember thinking that if I'm here a year, it'll be too long, but in reality, they were probably in their early 40s. But, you know, to me, I was like, oh, no, I won't be here a long time. And like I say now, 50 years later, I'm here.
I started right when Underwood and South Jersey Health System came together back in 2012. We didn't even have a name back then. We got together at a directors meeting and we were able to, the announcement came out that we were going to be in Inspira. And everybody kind of looked around each other and we thought that was great because it's a spin on inspiring. It's inspiring healthcare. And everybody clicked with that.
This has actually been an emotional ride. This celebration of 30 years. It's been over half my life I've been somewhere, and I'm very proud to be here and be part of this family. I hope I made a difference. I feel good about what we have done together.
So I got hired at Inspira in March as a per diem, and they, about a month later, offered me full-time, and I quickly took that and said, I don't ever want to leave here. And I've been here since. I went home and told my husband, I'm never leaving this company again. I love it here, and this is home.
I think I was 5 years old that I knew I was going to be a nurse. 30-something years later, I still love what I do. Every day is different. There is no 2 days ever that are any much the same. They're always different. And I like caring for people. Actually, I love caring for people.
I love being a nurse. I used to tell my husband, I could do this even if you didn't pay me. Of course, I do like the paycheck.
It doesn't feel like a job to me because I think it's what I'm born to do. I enjoy working with people. I enjoy helping people.
I like helping them, like seeing their smiles on your face after you make them feel better, or you at least can make them feel comfortable for that day and everything. So it's just a little satisfaction you get from knowing you did something good for someone else.
When you walk into a patient's room and you see how they're feeling, and you know your words, your kind words, your compassion, your empathy is going to brighten their day when they're in one of the worst stages that they could be, there's no feeling like it, knowing that you made that impact.
I get up in the morning because, number one, it's a great feeling to be able to help people, to see your peers, to work with everyone, and it's very motivating. Outside of work, I'm involved with a lot of animal rescues. I'm on the board with the Funny Farm. I'm the vice president there. And, it's a sanctuary. It's in Mays Landing, New Jersey, and it has roughly right now, there's probably over 600 animals there. They're all large animals. It's the largest animal sanctuary in New Jersey. I just want to thank the organization for the opportunity to have worked here for all of these years. It's been a wonderful experience, and I've enjoyed every minute of it.
It's like a family here. Everybody's concerned and they care about you. They go out of their way to say you're doing a good job, which is really great to hear.
You're not a number. Each department is like its own little family. We all care about each other. We all talk to each other.
I like the fact that even though we're a small department, like I think there's 10 of us in our department and we oversee 6,500 employees, I like the fact that they know who we are. I like the fact that even though we are getting bigger and bigger, we still have like that small feel.
I truly have a family in Inspira.
With your cranky aunts and uncles, but lovable. I've worked with a lot of people who really, really touch my heart in ways.
I can tell you one memory that really stands out. We had a patient who waltzed in on a Saturday morning having her baby and very upset because it was her wedding day and the baby was coming a little early. So she did really well and she was very stable. And so a bunch of us got together and called the supervisor and said, is there any way we can let her go to her wedding? And they said, no, not really, she can't leave. So we said, okay, is there any way we can bring the wedding to her? We had the girls in our locker room curling hair and putting on makeup and dresses and helping her get dressed in her room. And then the midwife and her nurse actually went to the wedding so that if there was any issue, she could, be taken care of right away, but she didn't leave the hospital. And we thought that was the coolest thing, that we got to be part of a really important day for a patient.
I was involved when we very first started the Thanksgiving delivery program. And so on Thanksgiving morning, back then it was a really small group of people that came together. We would meet for breakfast in the cafeteria in Vineland. And everyone had their families, and it was nice to see that element of someone's personal life. And it felt really good to be able to deliver a meal to somebody who otherwise probably wouldn't have had one.
As my coworkers all know, and that goes for Elmer as well as Vineland, when my daughter passed in 2008, I need to thank everyone, because the warm, open arms, the support that I received was unmeasurable. Everyone was there for me, everyone. People I didn't know came up and hugged me. We're a family, Everybody is there for each other, and with each other's help, we get through hard times, and good times too.
Well, in the emergency room, because you see so much, you see happiness, you see trauma, tragedy, you see families come together. The ER was the best. It was a really nice place to work, and it has really shaped me. It has made me know that nothing is impossible, that some crazy stuff can happen. You can't make that stuff up. And it's made me love what I do.
So I have a son and 3 daughters, and my oldest daughter just graduated nursing school at Rutgers and is working at Inspira Mullica Hill as a nurse's aide. And it makes me proud to see that she's following in my footsteps, and I really hope that she continues with Inspira, because I think she'll have the same experience that I did.
What I can honestly say is, like 5.5 years ago, when I look back, I started in an entry-level position and I only had some college credits. Today, 5.5 years later, I have a master's degree and I'm a network manager. I feel blessed. It's like the classic story of started from the bottom, now I'm here. You ever heard that song before? It's just like that. Like, I have a master's degree 5.5 years later and I'm a network manager. So I feel blessed to be a part of this organization.
I think that our recognition process here is fantastic, and personal stories keep you connected to your colleagues, to our mission and vision, and I am very thankful for all of the opportunities that this organization has afforded me.
Congratulations to everyone getting service awards. You've put in the hard work and the dedication to serve our patients in the community.
Thank you for letting me be able to serve along with you, because you're all absolutely fabulous people.
I hope I put a smile on your face with my crazy antics.
We've come a long way, baby. That's all I gotta say.
Cut. Good?